So my first comment would be, what is personalized medicine? Right? It's a very famous term, like nano maybe, and personalized. We as a company understand personalized. It's the individual treatment of one patient. So the perfect example is you take a tissue from the patient, treat it outside of the patient in some way, and reimplant into that patient. That's for us personalized medicine. If we're talking along that lines, maybe my colleagues to the left can comment better because they are engaged in it. We are not yet engaged in it. If you think about, and it's used also in the way that personalized is meaning more, you find the right patient group for the treatment, what I would call stratified medicine, right? You find the way how to stratify the patient population in a way that you can select the patient that will react positively to your drug, to your treatment in general, and whatever. Then we are engaged very much there. You might know that Erbitux, our oncology flagship drug, is accompanied for colorectal cancer with a KRAS testing, so only wild-type KRAS will be treated with Erbitux, and then the success rate for the patient is much higher. I think this is the way to go in this direction. And we don't understand that as personalized medicine because you are still just selecting a population that it's working for. So maybe personalized in the sense I have tried to define, and if that is your understanding, maybe my colleagues to the left should comment then.
No, I fully agree. I think that we have one example of personalized medicine, which is Cyprulocel, Provenge. But except Provenge, at least in oncology, I do not know any other example of personalized medicine. Some were developed but didn't reach the market, and also in the field of anti-tumor vaccine. And then it's not strictly personalized, it's just being able to define what will be the patient population who will benefit the most of a treatment. So in fact, you personalize according to the patient or according to the tumor characteristic. It's the example of Erbitux. You do not personalize taking into consideration the patient, except the general requirement like the performance status and so on. You personalize based on the tumor characteristic. Sometimes you will personalize according to the patient characteristic. The geographic ethnic can be a way of personalizing. So the third step can be to personalize the treatment, which means in front of a patient defining which type of drug will be optimal for this patient. And this type of approach is today starting. And I remember a presentation from Dan Van Oel 3 years ago at the ACR meeting, and he took patients who were treated with all available treatment for their disease, and he tried to phenotype this patient and give them what he was considering as being the most appropriate treatment. And it was sometimes a very old drug, like methotrexate or vinblastine, and sometimes a very new targeted agent, having or not having registration in this type of disease. So this is, for me, also a way of personalizing medicine, which is characterizing the patient and using within the armamentarium what will be the most appropriate.